Hi, so today I'm going to be talking about Duchenne muscular dystrophy, also known as DMD. So what is DMD? It's an inherited X-linked recessive disease that primarily affects young boys. It is caused by a genetic mutation which produces little to no dystrophin protein, which can then create an incomplete dystrophin glycoprotein complex. This leaves the muscle vulnerable to contraction-induced injury, leading to eventual muscle weakness, decreased muscle tone, and increased fibrotic tissue as a result of a chronic immune response. For patients with DMD, important aspects to their care include both a timely diagnosis and multidisciplinary care. While skeletal muscle is primarily affected, multiple systems are also eventually affected, such as the respiratory system and the cardiovascular system. The digestive system, however, is often overlooked, and especially when nutrition is such an important component of care for patients with DMD, this should probably get more of a focus. Some of the gastrointestinal complications in patients with DMD include an altered function of gastric smooth muscle cells, which tends to cause delayed gastric emptying, and this delayed gastric emptying causes a gastroesophageal reflux, and because of immobility, weakness of abdominal muscles, and inadequate fluid intake, it causes constipation. This constipation can only exacerbate the symptoms of DMD. Autoimmune diseases such as muscular dystrophy are also associated with a dysfunction in the microbiome, or dysbiosis. Although there are literature stating how dysbiosis affects muscular dystrophy, there is currently no exact literature describing the mechanism in which this occurs. However, I have found a possible correlation to this. Some prevailing characteristics of muscular dystrophy include lower skeletal muscle quantity, lower muscle strength, and lower physical performance. This can also be seen in sarcopenia. Sarcopenia, as described by a study conducted by Kazuma et al., is a condition that involves a loss of muscle mass and declining strength or muscle strength with age. Severe sarcopenia combines those three characteristics of muscular dystrophy and even its subsequent molecular regulatory pathways. Through this study, they were able to classify those adults with muscular dystrophy according to this criteria of sarcopenia. It can be inferred that DMD is essentially an advanced stage of sarcopenia. If we can analyze what may affect sarcopenia through this relationship, we could possibly utilize those strategies to be applied to DMD. In relation to gut microbiota, there is already an axis describing the impact gut microbiota has on affected skeletal muscle and smooth muscle cells through sarcopenia. Grzycki et al. Developed a gut-muscle axis. The initial gut dysbiosis increases the amount of intestinal permeability, causing microbiome changes. This increases the amount of inflammatory cytokines that affect the skeletal muscle tissue, such as interleukin-6, TNF-alpha, MCP-1, and more. The resulting muscle pathology is an increase in size but also an increase in degradation, and the composition of the muscle has multiple fat infiltration. The muscle then reduces strength and power, and only results in an exacerbation of disease and further compromises the characteristics of skeletal muscle. In the gut microbiota, there could be different bacteria that could be utilized to alleviate the symptom of inflammation in patients with DMD. We could induce anti-inflammatory responses through a particular bacteria called Bacteroides fragilis, which utilizes both innate and adaptive immune mechanisms to generate protection. What propagates this is a molecule in its capsule called polysaccharide A, or PSA. PSAs activate plasmacytoid dendritic cells, or PDCs, so that way they could activate T cells. These induced regulatory T cells secrete anti-inflammatory cytokines such as interleukin-10 to thereby limit pathological inflammation in the gut and even more distant tissues such as our target skeletal muscle. With the right combinations of dietary carbohydrates and proteins, we have the potential to reshape the metabolism and population of bacteroids to influence the metabolic balance of the microbiota, and in a sense be able to alleviate at least one of the symptoms of DMD, which is inflammation. Further studies should be conducted to determine the exact mechanism in which gut microbiota influences Duchenne muscular dystrophy. However, there should still be a point to improve nutrition, especially adding certain aspects of nutrition to promote a better gut microbiome.